The pelvic girdle consists of the right and the left hip bones. Functionally, the girdle joins the lower limbs to the axial skeleton, specifically the sacrum of the vertebral column. The girdle transmits weight of the upper body to the lower limbs through the hip joint. The pelvis is the collective name of the hip bones and the sacrum together as a single unit. Compared to the pectoral girdle, the hip bones are robust, weight-bearing bones that have limited mobility. The hip joint is also a functionally much deeper socket than the shoulder joint is, which adds to that stability of that joint. But this joint is much more limited in its mobility as a result. The hip bones possess three regions: the ilium, the ischium, and the pubis. The names of the regions reflect the names of the fetal bones that developmentally fuse and form the adult hip bone. Figure 8.13 examines the hip bone from the lateral and medial perspectives, with the lateral perspective being on the left side and the medial perspective being on the right side. Our main focus will be the lateral view. From here, we can see all three major regions of the hip. The ilium is the superior region, the ischium forms the inferior and posterior region, while the pubis forms the inferior and anterior region. The ilium is the largest of the regions of the hip bone and the region that is located superiorly. There are a few structures of interest on it that we will examine. The iliac crest forms the superior margin of the ilium. Follow it forward and we arrive at the anterior superior iliac spine, which is a bony projection that is a site of muscle attachment as well as ligament attachment. Follow the iliac crest posteriorly and we find the posterior superior iliac spine. The greater sciatic notch is a deep indentation at the posterior and inferior side of the ilium, which allows for blood vessels and nerves to pass through it to the lower limb. Returning to figure 8.13 and locating the iliac crest, we can follow it forward to the anterior superior iliac spine and then follow it back and arrive at the posterior superior iliac spine. The greater sciatic notch is a deep notch located near the border between the ilium and the ischium. The ischium has three structures of interest. The ischial spine is the site of attachment for ligaments that bind the ischium to the sacrum. The ischial tuberosity is a roughened bony projection at the inferior side of the ischium. It functions as a site of muscle attachment for the hamstrings muscles and also supports body weight when we are sitting. The lesser sciatic notch is a small indentation between the ischial spine and the ischial tuberosity. The ischial spine, the lesser sciatic notch, and the ischial tuberosity are all located on the posterior side of the ischium. The pubis has one structure of interest in our study. It is the pubic symphysis, which is a fibrocartilage joint located on the anterior side of the pubic bones. It is located specifically between the two pubic bones of the left and right hip. And functionally, it joins the anterior side of the hip bones together, as the posterior side is joined and supported by the sacrum. Other structures on the hip bones that are of interest is the acetabulum, which is a deep socket on the lateral side of the hip, located at the intersection of all three regions. It receives the head of the femur to form the hip joint. And just inferior to the acetabulum is the obturator foramen, which is a large oval opening between the ischium and the pubis. It is covered with a large ligament and connective tissue and functions as a site of muscle attachment for muscles that are located externally as well as internally to the hip. So returning to figure 8.13, both the acetabulum and the obturator foramen are very prominent structures that are located on the lateral side of the hip bone.